Okay, starting with the question itself, which of the following is the most appropriate management for the patient? And looking at our answer choices, it looks like we were looking at some kind of intoxication. We have a 4-year-old girl in the ED, accidentally ingested unknown quantity of mom's prenatals, which contain higher levels of iron. So we're looking at iron toxicity. Child
Okay.
is lethargic and experiencing abdominal pain and vomiting. Lab tests reveal elevated serum iron level, which confirms that it is iron toxicity that we're looking at. So we're going to want to do activated charcoal.
Okay. Final answer.
Final answer.
Okay, perfect. Okay.
Ah,
So let's talk about this here. So iron, um, deferoxamine infusion.
mhm.
Okay. Activated charcoal. This can be helped to prevent absorption, right? But now
Okay,
it's already in the bloodstream. Okay.
gotcha. So because of the severity of the symptoms, that's what would have shifted it.
Yeah. So
Okay.
the idea is this, right? Charcoal helps prevent kind of the ingestion of it, or absorption, I would say, right? So if you think that
Mhm.
it's, to be honest, a lot of the answer choices now aren't charcoal, I would say, um, is kind of what I'll lean against now. When you're looking at these toxicity questions, right? This one, there's not. I know this sounds weird, but there's not much logic behind these questions, right? A lot of these questions are memorization, right? So deferoxamine is going to be kind of your chelating agent that kind of
Mhm.
binds to iron and kind of prevents iron from wreaking havoc once it's in the bloodstream, right? And then you excrete it out. But you never want to do a gastric lavage, pretty much. Um, unless they say that unless it's in your stomach, but on a testing standpoint, right, you're really not, there's not many times where you're going to do a gastric lavage.
Okay.
Sure, maybe the kid just ate the pills and he ate a lot of them, then maybe, but most of the answer choices now, they're really testing you. Do you know what is used, for each toxicity, right? So
Mhm.
key things to look for, right, is when you're studying this, try to study in tandem. What I mean by that is, learn iron and it's kind of chelating, right? Learn lead and what you need for lead, right?
Mhm.
So you're kind of going back and forth because you know that they're going to only ask you and compare against the toxins, you know?
Yeah.
So learning it in
No, that
tandem.
makes sense.
Yeah. All right. And of course, right? Look, I mean, we didn't talk too much about it, right? But whole bowel irrigation, right? Almost never, right? Observe and
Yeah.
supportive care. Kids like dying, right? Clinically, probably not super,
Not the
super.
best
Yeah, not the
decision.
best, right? Like we said, gastric lavage, unless the kid has eaten it acutely, has no symptoms, but it's in the stomach, then sure, maybe. But like I said, a lot of the times this is not going to be your clinically correct answer because they're only giving you clinical scenarios where patients already intoxicated by whatever it is, right? And
Yeah.
then activate charcoal, like I said, right? It's already absorbed, so can't really prevent
Yeah,
absorption.
so it doesn't really help it anymore. Okay. Yeah, that makes sense.